Hi everybody, Shelley-Jo here. I realized that I'm here in my kitchen classroom, and I know that we never got a chance to talk about butterfly setups or winged draw setups, whatever you want to call them. So we're going to do them here in my kitchen, on my kitchen table. Here we go. I'm just going to turn my phone around so that I can show you what we're going to need. So give me 2 seconds to get this done. Okay, so these you already know about. They're barrels for some people call them vacutainer holders, or some people call them hubs. They're not really the hub. The hub is the middle of the needle, but these are vacutainers, barrels for the tubes to go in. We're familiar with those. This is a straight needle. You're familiar with this as well, right? We've been using these. And we know that the parts of the straight needle consist of the sharp that has the sheath around it, the rubber sheath, and the sharp on the inside on the part that goes into the barrel. And that rubber sheath, if you'll remember, I'll just review, presses up against the rubber in the tube, the sample tube, in order to make a good seal. And we have a vacuumed system, so no air gets in. The other side, we'll remember, has the safety cap and the needle, and with the bevel that is always up. We can remember that from our classes. And of course, when we're done, we click. We're going to put that right there. Now, what about a butterfly needle? What's the difference? They come in a little pack like this. This is a BD butterfly. There's other brands. This is what I have, what I use mostly in my jobs. So, and they're wrapped in plastic, and we'll take it out. So what's the difference? Here's the needle, the sharp with the sheath around it that will go up against the test tube. So where do you think this end goes? Correct, in the barrel. We screw it on, give it a nice little push and a turn, push and turn, just tight enough, not too tight. But the needle isn't connected right here like it is here. It's connected to the barrel by a line of plastic tubing. All right. And then this is your sharp that goes into the patient, or the arm or the hand. And here is the sharp. This is the hub. And then here is the sharp. So I'm just going to carefully take this off. They can be kind of tight. You give them a twist and a pull. So it's the same thing. It has a bevel that always has to be up. And it's the same thing, except basically you have this long line in between where the tube goes and the part that goes into the patient. So what do we hold? We know that when we're holding the needle to draw a patient with a straight needle, we hold the barrel and then we insert the needle into the patient's arm. So what do we do with this now? We don't have that. We hold this. This is flopping around. I'm going to carefully recap this. You would never do this at work, but just to show you. So with these, that's why we have these little wings. Well, there's 2 reasons, but the first reason is we need something to hold. Some people hold the hub, but you really shouldn't. You should be holding these butterfly wings because it gives you a lot more maneuverability. I don't know if you can see that, but there's some writing on these wings, and one of them says BD. So you want the BD up. If the BD is up, you know that your bevel is up. So bevel up, BD up. So you have your needle in the correct position. But you're going to grab these butterflies, hold them, and use them as your handle to insert the needle into the patient, bevel up. Now, once you have the needle into the patient, if you will pretend that that's in the patient's arm, and you open it up, you see that these butterflies then relax. And what they do, their second function, is to keep the needle from spinning in the arm. You see how it stops it from just spinning. If these weren't here, this needle, when you were maybe maneuvering your tubes or manipulating the needle, could just spin right around. But because these wings are here, it stops the needle from moving too much in the arm. So that's their second function. All right? Now, the third thing that we need to talk about is the safety. In the straight needle, we know exactly where it is. We slide when we're done drawing, as the needle comes out of the patient, we slide our thumb up and we click the needle, right? Well, here we don't have one of those. So where is the safety? I'm going to show you. On the hub, on the yellow hub of this needle, is a square part that has a little ridge to it. That's where you're going to grab the needle to take it out of the patient. So we're going to pretend that we're taking it out of the patient, right? And then to safely cap this needle, I'm going to back up just a little bit so you can see. I'm going to grab the plastic tubing with my pinky as close as I can to my thumb. And then I'm going to push the needle up, the yellow casing or hub up, and it's going to encase the needle. And you hear the click. So again, I'm pulling the needle out of the patient. I'm grabbing it with my pinky as close as I can to my thumb, and then pulling and putting a sheath over the needle so that it's safe now. It's got a safety. That's the safety precaution on the butterflies. Where does it get disposed of? In a sharps box, just like this. So there you have it. The differences are this tubing in between the sharp that goes in the patient's arm and the sharp that goes in the tube. And why would we need this? Why is it important to have this? There's a lot of reasons. Some that I can think of just off the top of my head are a baby. You might have a baby being held by a parent or maybe squirming around a little bit, and it's nice to have a little bit of flexibility. Once that needle is in the arm, you have a little bit of wiggle room. Some people have tremors. That would be appropriate. Also for a difficult draw. Sometimes I use them if I really feel like I'm going to have a difficult time finding a vein on somebody, but I've got a pretty good idea, but I think I might need to maneuver a bit. I'll use the butterfly because you get a little bit more maneuverability out of it than a straight needle. Also, when you get a good stick on a butterfly, you will see the blood flash into this area of the needle, and you'll know that you're in there. And that's why they're good for hard sticks, because once you see that flash, you know you're in, and you can be sure that you're going to get a good sample. Well, hopefully you're going to get a good sample. So that's that. So we're almost done with the video. I want to have like one more minute just to talk about these. So they're very helpful for several different reasons, and you'll find your own reasons to use them. Everybody has different reasons. I often will use them if a patient's lying in a bed and I'm reaching in an uncomfortable manner in order to have to draw them. But I've seen phlebotomists who I work with do exactly the same thing with a straight needle. So everybody's going to have their own reasons to use a butterfly needle. We do use them exclusively in hands because of the risk of nerve damage in a hand. We use the butterflies. So they're important for that. So I'm going to sign off now. And my next video is going to be, I'm going to draw a very good friend of mine who has volunteered to let me draw her. And my son will be the cameraman in this high-tech world of ours. So take care, and I'll see you in the next video. Bye.